has flopped, you can be talking about the stage 3 or stage 4. And we also indicated that when the wound gets deeper, because remember, if you let's look at pressure ulcers only, you got the epidermis, which is stage 1.
Stage 1.
Stage 2 is your dermis. Stage 3 will be your subcutaneous tissue. Stage 4 will be your muscles. And what's the new muscles?
Bone.
So therefore the infection goes down, it's going to cause the bone to get
Infected.
What is the infection the bone called?
Sepsis.
Osteomyelitis. Once it is penetrating, it goes down, infect the bone, osteomyelitis. Although we looked at the treatments you can put on, we said there are things that you have to let your staff know. Or what are the things we say you have to let your staff know? To help, prevent, and or help to heal. So, what your staff need to know? You need to tell the patient every 2 hours or 2 hours in, right? Why?
To relieve the pressure from the site of wound.
Because you want to do what?
Relieve pressure from that site of wound.
But they don't have the pressure, they haven't had the wound is yet. So why are you doing it?
To prevent pressure ulcer to
Prevent also
at the injuries at the site of the infection.
Where's the site?
of the wound.
It's not a wound yet.
Always not the wound.
Where's the site?
Affected. The site
The
affected.
site is going to be where you have what? Bony
Prominences.
It don't happen in the belly, right? It don't happen on top of your breast.
Oh God.
But wherever you have the bone is close to the surface, that's where you have to do what? Relieve the
Relieve the
pressure.
pressure.
But remember saying yesterday, if you sit down for 15 minutes and you don't move, you're going to have pain.
Right.
Imagine somebody just lying there, they will have that problem. I say you can't get it in the breast, but you can get it under the breast.
Pressure
Right? You can get it under the breast. All right.
Well, we have the bone.
What else would you want to tell your patients? Come on, let's move. What else do you want your patients to know? To what?
No, the patient to know.
You're saying to prevent the pressure ulcer, right? To prevent the pressure ulcer?
To prevent
Prevent pressure ulcer?
pressure ulcer. We're talking about prevention. What?
Activity.
Come on, you the nurse. You the nurse in charge. You need to say what to do.
Well, the wound is not big.
Incontinent. Why incontinent? Remember why?
Because the
Right, because
because of the food gonna break the
The acid from the what?
from the urine gonna
if it stays on the skin for too long,
it's gonna break down the skin.
What acid you guys are talking about?
urine
The uric acid.
over time.
What acid are you talking about?
I'm not saying acid. She
No.
I don't mean acid. I mean
Just say acid. Don't say
I changed it. Okay.
uric
acid. Okay. Thank you.
Uric acid. That's
I
what.
said that.
Remember, what percentage of your urine is
Uric acid.
water? What percentage of your urine is water?
90. 70. 75.
Boys, he's gonna dance.
The gravity of the being is
Come on, what
25,
percentage
right?
of your urine is water?
90.
No,
97.
96% of your urine is water. Most of your urine is water. The rest of your uric acid. And that's the part that can create some problem if it makes your skin. But you know what causes more damage to your skin? The feces. The feces cause more damage to your skin. But apart from that, if you already now have a wound, you have a skin break,
Yes.
and the feces go into the,
Infection.
what happens? It causes the,
UTI.
when the feces go into the wound.
Okay.
Infection.
Infection.
But what you want to know, as the registered nurse who's giving instructions, and you developing your care plan, you know that if feces get into the wound, it will do what?
It will break down the skin. Yeah.
Infection. And if you get infection, what's going to happen?
Delay healing.
I remember somebody giving a scenario where somebody had also the mouth, and
To be honest.
it was not healing because the feces keep going into the urine
With the
also.
Yes, we cover the one with.
Talk too much.
All right, guys. We said you had the, we said you had the slough, right? And we said slough is what? The necrotic slough.
Right.
And then we said that inside this wound you have some exudate. Yes. Right?
Enzyme.
That's no water. You have an exudate. And this exudate is bad for the wound, right? So you use things like what? What do you use to get rid of this exudate?
And you take a seat.
Exudate. 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 How you gonna get rid of the exudate?
Treatment, antibiotics. Take the pus out.
You clean it? Absolutely. Why do you have that wound vac? What's the first wound vac? There you go. To get it out. The wound vac, get rid of it, right?
Move back. Get rid of the exudates.
Why do you guys use calcium arginate?
To absorb the
You guys did the research.
Yes, to absorb
That's why you did the research.
oxidations.
What's the function of the calcium arginate?
Absorb the wound. The exudate absorbs it.
Why you guys are saying it? That's a treatment, right?
The oxidation, it's calcium.
And it's helpful what? As much as severe, moderate, exudate.
Right. Moderate to severe. To help.
And then, sometimes the wounds can be dry, right?
Yes.
Yeah.
And we do what? What do we put the employee want to become moist?
Hydrogel.
So easy it is.
Moisture.
And at times, you find that this necrotic tissue, because you have poor blood supply going to that area,
Yes.
it's not healing, right?
Yes.
So you have to get rid of the necrotic tissue. So what do?
You serve the
Debridement.
You do debridement. And we talk about 3 types of debridement here.
Yes, we did.
We said you have, number 1 is there.
Mechanical.
So because when the wound up or the
Scalpel. With a scalpel to scrape it.
using what?
Scalpel.
Scalpel, Gillette, scissors, all that stuff. But remember we were trying to say that, look, if the patient is alert, they're not going to do it in there. They're going to send to the hospital to do it under anesthesia.
Because of pain.
Right? General anesthesia, so because wounds are
Painful.
painful except
If the person has no feeling.
wounds are painful except
when the tissue is done.
No, we said first degree. It's not third then. It might be
the
better.
last feeling, and the feeling is what?
We are perfect.
Also.
Also.
Come on guys, come on, it could work. Alright?
Oh, so lose feeling.
Hold up.
Very good, very good, very good, yeah.
And remember that the neuropathic ulcers don't form as what? Big ulcers. They start as what?
Very small,
Minor. Very minor.
yeah.
And the person don't know that they have it because they don't have the what?
Feeling,
The sensation is gone.
exactly.
So it will get worse because what they keep doing.
They keep putting pressure on it.
And putting that pressure absolutely on it. And when this happens,
It gets bigger and
they
bigger.
say what can happen?
Amputation eventually.
Amputation.
Go
And
down.
persons who normally have these is diabetics.
Smokers.
Remember your diabetic, peripheral neuropathy.
Diabetic peripheral neuropathy.
Okay?
Alright. Peripheral neuropathy.
Neuropathy.
Neuropathy. Neuro.
Ah,
Okay. Got it.
I might speak English, but I could write it.
Alright.
Yes.
That's good. That's good.
And I might go to school in English.
Oh. It hurt me. It hurts. Hit me too hard. You said you didn't go to school, what happened?
You become like an egg now.
You said you didn't go to school, what happened?
English school.
Oh, wow.
Most of the words. Shows French classic French.
Oh, wow. Okay.
You know, I was in there. You review it for me.
Huh?
You review it for me.
What's that? What's that? What's that? Up on it.
Alright, since this year starts with GI, right? Pathophysiology. GI, right?
Respiratory.
What else we touched on? Come on guys, what else did we touch on?
Respiratory.
Blood pressure,
No, let's talk about the systems and the system diseases.
I thought it was going to the jail. I thought it was going to respiratory. I'm not doing reproduction. I thought it was doing reproduction.
What have we done? What have we done?
In regards to patho,
No, the heart, we did the heart, right?
we did cardio.
We talked about the pathophysiology.
Calculation.
Pathophysiology is what you're focusing on here, right? We said now we
Take it
put it
into-
together. So what is it what they've done until now?
Integumentary. We did the skin, that's integumentary. Yeah. And that's what we did. Integumentary.
Reproductive.
You guys did your reproductive system already?
No, we said we were gonna get to it.
I'm asking again what you did until now.
Oh,
We have GI,
cardiovascular
cardiovascular.
disorders. No?
Yeah, we did.
Okay.
Integumentary.
Tegumentary, skin disorders, which is what we're talking about right now.
We did the GI, right? We did the GI. Integumentary.
Alright guys, you gotta try to, because this whole program that you're doing is to get you introduced, especially to a person who is not done nursing. And when I mean not done nursing is either licensed practical nurse. We're now moving on to the RN. Okay? So you gotta remember the things that you do. And you know, as I said, I put these things up here. So when you come in, just on this final seat, if you have the time, look. Look at these systems. Because these are normal. Everything here is normal. What you want to do, now that we're doing the pathophysiology, is see what the disease are doing to these normal systems. If I say the liver, what would you guys tell me in the pathophysiology? What disease affects the liver? Pathophysiology. Patho, the disease. Physiology, how it works. So you did the anatomy-physiology, now you're doing what? The pathophysiology. So you have the liver. We touching the liver where we did the what? The GI system. And what is the function of the liver? Detoxification.
Detoxification gives the feces color.
So what happened? How does the liver become involved? How the liver becomes involved? How? Just give me the physiology now. How it works?
After that's the Holy Ghost, it has to go to the liver to detoxify before your body absorbs it.
How it gets to the liver?
After you leave, you got the small intestine, this absorption,
Where exchange take this
and then after the small intestine, it goes to the large
Like the gas
intestine,
exchange or
which is the colon.
No.
that's not anything, that's a kidney.
After absorption.
You would say.
This is where the secret
How does
the gallbladder.
go back to your
Store the bile,
physiology?
right?
How does this liver
The process.
detoxifies and detoxifies what?
Blood.
Food. Okay.
And then
Guys, just put up liver. Functions. Let's put up functions of the liver. What are the functions? One,
To me.
somebody
trying to get to?
somebody just read. What are the functions of the liver?
all the blood leaving the stomach.
Oh, you're on, okay.
The liver.
All right, stop. So what you just said?
Control.
All the blood that is leaving there, stomach and intestine, the blood that is leaving there, the GI system is going to the liver before going any other place. Continue, please.
The liver processes this blood and breaks down balances and creates nutrients and also drugs into forms that are easier to use for the rest of the body, but that are
Toxic.
non-toxic.
The liver prepares it for the rest of the body. It gotta go to the liver. When it gets eaten and gets absorbed in the system, the GI system, the small intestine, it goes to the liver first. That's why you can't live without your liver.
It's a big job.
The liver gotta take it now. This is where basic anatomy and physiology begin. Now you're in the pathways, you gotta go back to that. You know, you understand when the liver has a problem, and what are the problems you should talk about? cirrhosis of the liver. And what is cirrhosis of the liver? What's cirrhosis of the liver? When the liver cells get damaged, they're replaced by fibrous tissue,
Scarring of the liver.
and this don't work
Damage of the liver.
as the normal liver cells would work. So now that this happened, the liver is losing its what? Function. Now it
Function.
cannot what?
Filter is good.
Amplify and prepares the nutrients for the rest of the body. The liver is very, very
Jaundice,
important.
fatigue, from weakness, loss of appetite.
That's why when persons drink alcohol, it goes what? To
To the liver. To detoxify it.
Here's your
So
silence.
that's part to see the stomach, the liver can use. Right, guys, with me?
Yep.
So a person who have issues with the liver, and we're going to put a couple, right? One, we know that's cirrhosis of the liver, and that's the beef down. Make a note, cirrhosis of the liver. Now, that's cirrhosis.
CIRROSIS. CIRROSIS.
Now put on hepatomegaly.
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 HEPACOMEGALY. That's when the liver's blowed up. Big. HEPATO. Oh, it's right here. You see it?
Next, the third will be hepatic hypertension.
But when we say, we have to analyze the message. It's on our streets.
Hepatic hypertension, you said?
Hyper, right?
Hyper, up, high. Cirrhosis, hepatomegaly, hepatic hypertension. Yep.
So we got cirrhosis of the liver, you have hepatomegaly, you have
Hepatic hypertension.
which is also known as
Portal hypertension.
portal hypertension.
Portal hypertension.
Portal, P-O-R-T-A-L. Portal and hepatic hypertension is the same thing. Hepatic hypertension or portal hypertension is the same thing. P-O-R-T-L hypertension. Now let's go to fourth. On the fourth, vitamin D3s. Hepatic encephalopathy. Hepatic
Hepatic encephalo. H-E-P-A-T-I-C.
No,
Hepatic.
hepatic. H-E-M-A-T-I-C.
L-O-P-A-T-H-Y.
L-O-P-A-T-H-Y. Hepatic encephalopathy.
Hepatic encephalopathy. You see it? Go ahead.
You see it?
A-N. Let me see it slow down.
It's right there. You got it? Okay. Brain disease that is characterized by loss of brain function.
Right. So you see when we eat our food, when we did the digestive system, we saw how that food can lead to certain conditions in your blood, right? So we went from the digestive, we flow into the blood diseases, right? We talk about the heart and how the heart can be affected by the buildup of plaque, which is again related to the food that you're eating. Now looking at how the food or what you're consuming affects the liver, and affecting the liver, how it now affects your entire body. So last not being the least, let's look at portal hypertension. Or why are we looking at portal hypertension? Because portal hypertension occurs when the blood is taking the nutrients from the digestive system to the liver. So in your laptop for a portal hypertension, and guess what causes this portal hypertension? The same cirrhosis of the liver.
Yes.
Cirrhosis of the liver causes the portal hypertension. Alright, so let's get a little more into this portal hypertension. So what's the definition? Portal hypertension is an increase in the pressure within the portal vein, which carries blood from the digestive organs to the liver. The most common cause is cirrhosis of the liver, but thrombosis might also be the cause. And what is thrombosis?
Blood clots formation.
So this clot is blocking that flow of blood that is going to where? The liver. Now increase in the portal vein causes large veins. Yesterday, remember we talked about the large veins? What are the large veins? What are the name of the large veins?
Varicose.
Varicose. Well, you use the word varicosities or varices. Use the word varicosity or varices to talk about these veins in the large. And when we say it could be anywhere. So yesterday, we were talking about the legs, but then we found that it could also be your butt. Already the butt is your hemorrhoid. Now we find to be where else?
Anus.
Now we find it's where? We just said in the legs, and we said in the butt, the hemorrhoid. Now where else?
Your
We talked
anus.
about it right now.
Oh, your liver?
What you said, Mr. Owens?
I said anus.
The question.
We are talking about portal hypertension.
Okay.
Are we talking about the vein?
They talk
We talking about the liver.
the vein.
Why are we going to the butt
Is
and to the thighs? All we talk about the butt and the thighs is to say varices
Yes,
can happen in these places. But right now we're talking about the liver. And we do portal hypertension. Please look at the image of the portal vein. That's all I want you to see. Look and see where the portal vein is at. Image, portal vein.
Connect the liver to the gallbladder. Connect the liver to the gallbladder.
Cirrhosis.
No, connect the liver to the pancreas. Yeah. And the spleen. Between the liver and the pancreas.
We're saying that this increased pressure into portal vein causes these varices to develop across the esophagus and the stomach to get around the blockage. And the blockage is usually up in from your what? Your liver itself with the cirrhosis of the liver. They say these varices can become fragile and bleed easily. Just like the ones in the butt, you know you have the bleeding hemorrhoids. And some people, their varicose veins can pop
And they can
in their legs.
bleed a lot.
So varices, it's because the veins are distended. So the walls are much more thinner, right? What causes portal hypertension? The most common cause of portal hypertension is cirrhosis or scarring of the liver. Not using the Etienne word, scarring. Right, Etienne? Cirrhosis results from the healing of a liver injury caused by hepatitis, alcohol abuse, or other causes of liver damage. In cirrhosis, the scar tissue blocks the flow of blood through the liver and slow its processing functions. Portal hypertension may also be caused by You said it just now. The clot, thrombosis,
Blockage.
got developed in the portal vein.
Blocking the blood supply.
Now, what are the symptoms of portal hypertension? The onset of portal hypertension may not always be associated with specific symptoms that identify what is happening in the liver. But if you have liver disease that leads to cirrhosis, the chance of developing portal hypertension is high. So when you are having conversation with persons who are alcoholics, apart from having problems with their, like corticals, problems with their memory and that sort of stuff, you want them to know that can happen to their liver, that it can affect their entire body, including getting viruses in places like your esophagus, which is in the throat. Okay? Now the main symptoms and complications of portal hypertension include, and again guys, see what it says, the main symptoms and complications. Remember yesterday what I told you guys?
Look up the
Everything is
complications.
complications. Everything you do. Everything in this nursing process, look up complications, because that's what you're going to be doing. And that's where your questions is coming from for the state boards. Complications, complications, complications. What happens when a patient is having problems? Okay? Now you have gastrointestinal bleeding. You get what? Black, tarry stools, or blood in the stools, or vomiting of blood due to the spontaneous rupture and bleeding from viruses. So where this spontaneous rupture is going to happen? You said
At the side of the
spontaneous
blood
rupture of these varicose veins. That's going to end up with the patient having blood in the stool or vomiting blood.
The stomach.
If they have upper GI bleeding.
When you're in esophagus, in your stomach.
Yes.
And remember, when something gets black, stay with me because we talk about this. When the stool is black, it means what?
Upper GI.
Upper GI bleeding, because it's now being altered.
Yes.
So you get this dark stool, you know it's coming from up higher. Person up the ones in the throat might have up. So the blood is going down and it's changing, right? But sometimes it could be blood that is being coughed up, and that is not going to be black, it's going to be red. Alright? Now check this one out. Ascites. Now you guys know what's an ascites, right? A-S-C-I-T-S? Accumulation of fluid in the abdomen. And there is where, as a nurse, what do you have to do when persons have ascites? You have to measure what? Well, what you have to do when you're a nurse? Come, you know, you have to know this sometimes. Come on.
Your stomach swollen, like you have difficulty to turn around because you have
Also,
inflammation.
what you have to do?
Wait, I guess.
Or you have to put them in body fluid. And fluid restriction.
If the patient is having this big ascites, it means accumulation of fluid.
Yes.
Right.
So if the patient is having fluid, what the doctor is going to do?
Measure,
He's going to give them
taking output.
medications to get rid of their fluid.
Diuretics.
And how will he know that it's working?
Wait.
The weight. When the patient is clean.
You want to check blood measurement.
Yes.
Okay.
GIRTH, girth measurement.
Are you ready? And also weighing, right?
Yeah, you wave, but you want to girth measure, how you know what's going on? You guys see girth measurement? Please look it up and look at an image. Don't just look what it means. I want you to use images to do the association. Don't try to imagine what it looks like. Look at the picture of it and know what girth measurement is like.
Take it with your belly.
GIRTH.
This is good.
GIRTH.
How you spell it?
GIRTH.
So you're gonna get a tape measure.
Yes. Pass it around the belly.
And you're gonna do the daily measurements.
Every day.
You gotta record it, right? Guys, look at it, look at it. See what it looks like. And you know what you have to get, the equipment. Which will be the tape, and of course, we're gonna document it. More likely, everything now is computerized. I mean the computer and the patient's records. All right?
But when it's like that, Mr. West, you have to put them in fluid instruction because since they have
Got you.
the doctor, yeah.
Right. Now, encephalopathy. Remember I give you guys was what? The charge, right?
Hepatic encephalopathy.
Encephalopathy is another sign. And this is show confusion and forgetfulness caused by poor liver function and the diversion of blood flow away from your liver. Encephalopathy. You can get encephalitis. You heard that, right? Inflammation of the brain. But this encephalopathy happens not on the brain, the center, it is not, and guys stay with me. Hepatic encephalopathy is not at the brain, is the center of the problem. The center of the problem is at the liver. And this now affects the way the person makes decision and reason. Encephalitis is when you have an inflammation of the brain itself. Are you guys with me?
Yes.
Don't mix it up. Because you got a question talking about hepatic encephalopathy. You may just see hepatic and you run along the wrong road. Hepatic liver encephalopathy. What's happening in the liver is causing problems with the person's ability to process information, reason, decision making. Patient can become very, very confused. I don't know if you have ever had a patient with encephalopathy, person who had hepatitis. Because you know you have hepatitis what? B, C. Right. Cause damage to the liver, right? And do you ever see a patient who have hepatic encephalopathy is really messed up? Persons are really, really, really confused. I had several occasions where I had persons with hepatic encephalopathy. Very, very confused persons. Very difficult to manage, and you know, and you're going to be passing away. They're extremely hard to take care of. Because you got to be up and you put all the time with them. Now, how do you know the difference? You talk about confusion is not just related to that. The persons can be, in this room you may have persons having dementia right now. I'm serious.
It's true.
And this will be a health person who started the process of dementia. It's something that will just happen like that.
It's growing.
And it builds up, and you know, the little thing doesn't get start to forget, and little thing, until they become really pronounced now. You can really see, oh my God, she's like, you remember where she's at. Then you have a problem. But your hepatic encephalopathy, you want to see related to the liver. You want to see changes in the skin, in the yellow, and all that sort of stuff. Alright. Why still be please? You have reduced levels of platelets or decreased white blood cell count. Decreased levels of platelets. So what do we use the platelets for?
Healing.
Clotting.
Clotting.
And what's the other name for platelets?
White blood cells.
Where you spell it? Here?
No? Because
What's the other name for platelets?
that's white blood cells.
Anybody got any alcohol in here? How can you be sad? It's thrombocytes. Look guys, all you gotta remember is 3 of them.
Leukocytes.
Thrombocytes, leukocytes, and erythrocytes. Why are you mixing them up with other stuff?
Erythrocyte is the white blood
Red.
cell. Red blood cells. Leukocyte.
Sorry, I'm
Leukocytes.
taking this anatomy, physiology, and not to
The
stay
white is
focused with
leukocyte.
it's going to cause some concern with your studying, okay? Alright, they said now how are you going to diagnose this portal hypertension? You do endoscopic examination, X-ray studies, and lab tests can confirm varices, varicose, all the same thing. Bleeding. So when I see bleeding coming from these enlarged what? When bleeding is coming from the enlarged
Veins.
veins, that's an indication of portal
Portal hypertension.
hypertension. Okay? Now, far treatment is necessary to reduce the risk of recurrent bleeding. Because when a person bleeds, right, there's always chance of what? More episodes of bleeding. Because it might be a situation where clotting is a problem. And when a person bleeding and you don't fix it, you might have a temporary fix, like say putting a plaster, right? Without actually looking at the root cause. Then person will bleed again, and bleed again. Things such as what? That lady suffer with. Fibroids, right? Bleeding. You stop for a while, then bleeding again. And on till you do what? You
Die.
have surgery to correct it.
Or die. Or die.
That's it. Do surgery is corrected. But if you don't do surgery, what's going to happen?
You continue to bleed.
You stop it, you'll feel all right, and then what? A couple more weeks later or months? Wow. You're back in there. All right? So surgery would be the best. Usually for your varicosities, your varices, however you want to pronounce it, you need to have surgery.
What type of surgery is that used?
For wherever it is at.
The five.
For the enlarged veins. Look for stripping of veins. Just look for the term stripping of veins. For what? Stripping, S-T-R-I-P-P-I-N-G, stripping of vein. Or vein stripping, anyone.
Vein stripping is used to remove or tie off a large vein in the leg called the superficial saphenous veins. That's what I got.
Look at images again, please. These are the images.
Yes.
You know, sometimes persons may have varices in the legs, but it's not those big tortuous stuff. Especially people who have light color legs. You have what? Some blue, some just some blue stuff, right? Green?
Yes.
Green.
Mine all green.
All right. Green, blue, yellow. You know you have a different color little vein in the legs. Whatever you call you want to put it, that's all right. But they're not big and tortuous. And you can go to certain specialists and they inject some kind of dye in there and it disappears. Those are those things that is not those big tortuous veins where you got to strip.
They said you strip it. You need to strip it. Then you strip it. I hit them. I have them.
Yeah?
I am very fine.
All right, some tests and before receiving any perceived evaluation of medical history, physical examination, blood test, angiogram is a test that is done. Ultrasound is another test, and endoscopy. Now, what are the treatment options for portal hypertension? The effect of portal hypertension can be managed through diet, medications, endoscopic therapy, surgery, or radiology. Once the bleeding episode has been stabilized, treatment options are prescribed based on the severity of the symptoms and how well your liver is functioning. That's why they do things they call an LFT. Put up LFT.
LFT.
LFT stands for Liver Function Test. LFT.
Liver function test, yes. Blood test, use.
Especially when you're certain medications.
LFT, liver function.
Your liver.
Yes.
They're gonna have you do LFTs.
And protein blood. We have to do protein liver function test.
Guys got it?
Yes.
Basically want to see how the liver is functioning. If the medications that doctors might have put you on is causing some damage to the
Affect
liver.
the
Because
liver.
remember, the liver is the one that deals with all these detoxification.
Detoxification.
So the medications can cause damage to your liver. Now, first level of treatment. They say when first diagnosed with variceal bleeding, they'll be treated with endoscopic therapy or medications. Dietary and lifestyle changes are also important. I guess they're going to tell you to do what? What dietary changes possibly can we be talking about? Fatty foods.
Definitely no alcohol. Definitely no alcohol.
For liver function. No smoking.
Now, the endoscopy therapy consists of either sclerotherapy or banding. Now, look up the word sclerotherapy. S-C-L-E-R-O-T-H-E-R-A-P-Y, sclerotherapy.
LCL
ERO sclerotherapy.
THERAPY.
What is sclerotherapy?
Endoscopic injection with an endoscopic balloon.
To treat varicose vein and spider veins.
Right, those are little ones they call the spider veins, right? And it's more prominent in persons who have light complexion.
Yes.
And that's when we need to. Please look at the sclerotherapy if you can get an image. So it can imprint in your mind.
I have those.
Let's see please.
This is
Now it says sclerotherapy is a procedure performed by gastroenterologists. You heard this, guys? You know who's the
This is the spider one.
gastroenterologist? Are you with me, guys?
Yes.
Gastroenterologist. Normally, we'll hear the primary doctor saying that this patient is having problems with their the gastrointestinal system, and they're going to refer him to the GI doctor. You ever hear them say that?
Yes.
That's a gastroenterologist,
My doctor is
right?
right.
He specializes in the stomach and the small intestine. So if you think that goes on in there, he is a consultant for that. When you say you're going to send him to the GI doctor, it's to that specific person, the gastroenterologist. Now, banding is a procedure in which a gastroenterologist uses rubber bands to block the blood supply to each varix. A varix, again, same thing like varices, varicose, it all means it's a enlarged or engorged vein. And this guy, the banding, you have to do banding of what? The stomach, for people who want to lose weight, right? But he's not banding the stomach, he's banding the veins to stop the blood supply to these veins. If the blood don't go to the veins, what will happen? Because they have nothing to keep it up. Now, medications such as beta blockers or nitrates will be prescribed alone or in combination with endoscopic therapy to reduce the pressure in your varices and further reduce the risk of recurrent bleeding. Now, what have you guys noticed until now, since we're doing this brief reading here? You're finding that this situation with the liver is caused by blood and bleeding, and this blood and bleeding is called portal hypertension, and they're giving them a antihypertensive medication. They're giving them beta blockers. This is antihypertensive medication for something that's happening in there.
And the liver. Your whole body connects.
So you see the connection between the blood, the enlargement of the veins, which is in the circulatory system, right? But the problem is in the what? The liver. Which is a whole different system altogether. But we gotta please remember what's the function of your liver. Everything you eat, everything you drink, the liver is involved. Okay? Now, medications such as propranolol and cyclopamide may be prescribed to lower the pressure in the portal vein and reduce the risk of recurrent bleeding. The drug lactose You guys should be familiar with lactulose, especially in those nursing homes. Lactulose can help treat confusion and other mental changes associated with encephalopathy. Guys, look up lactulose, please. L-A-C-T-U-L-O-S-E, lactulose.
LACTULOSE.
Comme ça se prononce. How you pronounce it?
Lactulose.
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 I pronounce it lactulose.
Yes. How you pronounce it, this is how you practice. This is what I meant.
Hey. Let's see what one's it for. Why do you use the lactulose?
The
You hear it all the
drug
time.
is used by mouth rectally to treat or prevent complication of liver disease.
Yes.
Yes.
Lactulose is used to prevent
Complication
complication
of liver disease.
constipation.
Yes, this is
So
what
they're constipated. And it's specific
this is lactulose laxative.
people who are having liver disease. Stay with this, please. Lactulose is given to patients who are having liver disease to prevent them from becoming constipated. Remember that.
Okay.
If the same question comes up and they have lactulose and they put different conditions, you know it's going to go for the liver.
I'm
Alright.
allergic to it.
Be it hepatitis, cirrhosis, whatever, the liver, total hypertension. Alright guys?
Okay.
And I take it,
Okay.
and I take it my mouth swollen and everything. So
You try everything, huh?
And remember to get this specific, it's not just for the constipation, but it's given also to prevent persons from becoming what? Confused.
Confused, yes. Confused. It's
Now,
very-
dietary and lifestyle changes. Maintain good nutritional habits and keeping a healthy lifestyle will help the liver function properly. Some of the things to do to improve the function of the liver include the following. Do not use alcohol or street drugs.
or tobacco.
Do not use alcohol or street drugs. Do not take any over-the-counter or prescription medications without first consulting the physician or nurse. Some medications may make liver disease worse and may interfere with the positive effects of other prescription medications. So if you're accustomed to like going and buy stuff on the over the counter to take care of like even your if you find that you get it constipated and you want to get a washout, don't do it. Okay? If you're having, portal or risk for that. And when you're on this diet, you want to follow a low sodium diet. And you should be eating no more than 2 grams of sodium per day. How much is 2 grams?
That's mean low salt. Low salt. Low salt.
Gabriel, what's the 2 grams? What's the size? Last paper you wrote. You wrote on how much is the amount you should use in a day?
2 grams?
No, you didn't put 2 grams. You put 1,005. 1,500 milligrams.
1,500 grams. That's right. She was legend, that was, she said it's 500.
How many milligrams make up a gram? So this is where you're going to be looking at. And guys, you know, the things that you write, you got to keep them together. So when you are doing the other stuff, you're not going to lose it. And actually to say all your body need in a day, believe it or not, for proper functioning is only 500 milligrams. Very little salt for functioning. Don't need more than that. But you say you could go as much as 1,500. 2 grams is going to put you about 200, 2,000. And you should be reduced protein intake is required only. Listen to this, guys. Reduce protein. And we said we increase protein when?
For healing the wounds.
For the wounds, right? So you want to increase the proteins for healing of wounds. But if a person is having encephalopathy, hepatic encephalopathy,
Decrease protein.
you want to reduce the amount of protein in the diet.
Intake.
It's just like also if a person is having what? Rich dietary condition, we say is a rich man's disease.
A rich man disease?
When we spoke about gout, and we got to look at the intake, right? Protein intake. Now reduced protein intake is required only if confusion is a symptom. Now the second level, we say if you do all of that and it don't work, and don't control the bleeding continues, you may go through what's called a decompression procedure to reduce the pressure in these veins. Transjugular intrahepatic portosystemic shunt TIPS is a radiological procedure in which a stent, which is a tubular device, is placed in the middle of the liver.
I heard people always say spread that.
Then I have another one they call the distal splenorenal shunt. Both of them are shunts, right? Which is a, all right, let me give you the first one is TIPS, T-I-P-S. And when you're searching, just put TIPS and put liver disease, and it's going to pop up, everything's going to pop up.
Tips of liver disease.
Just put TIPS dash liver disease, and it's going to pop up.
Transjugular intrahepatic.
And it's going to pop up right away. Because if you just put TIPS, it's going to talk, but you're giving somebody money or you're giving somebody advice.
Transjugular
So you got to
intrahepatic
define what you're looking for.
portosystematic shunts.
Alright? And the second one is DSRS. Same liver disease. DSRS, liver. And then we're going to give you the whole distal, all the nice stuff.
Distal splenorenal shunts. Splenorenal shunts. Distal splenorenal shunts. It prevents rebleeding.
Spray, I put spray. I saw that. Come on, Hey.
Alright, let me just read quickly what is a TIPS. Now during the TIPS procedure, a radiologist makes a tunnel through the liver with a needle. connecting the portal vein, the vein that carries blood from the digestive organs to the liver. That's a portal vein. You guys with me? The vein that takes blood from the digestive system to the liver is your portal vein. And he makes his connection to one of the hepatic veins. The 3 veins that carry blood from the liver. Make it pretty easy for you guys. I think let's look at the board, right? Oh. Liver, right? For liver.
Of course.
So after the food has been digested,
Yes.
goes from the small intestines via the portal vein to the liver. And the liver now detoxifies, break it down, set it up so the rest of the body can use it.
And non-toxic.
Well, what is going to happen now? The liver is going to send what? It has 3 hepatic veins. That these are going to be sending on to other parts of the body. You guys with me?
Yeah.
So this one goes towards the vein. The hepatic take away after whatever is done up there. So what he does, he creates, because this here is blocked, because of whatever damage, so he makes a hole in here, so that whatever is done down inside here can go from in here
Toxic or
to the hepatic and go on to the rest of the body. You guys with me?
yes.
So the
Because
blockage.
this one here is blocked. The portal hypertension, this one here, look at the portal HTN. Let's do it again. Well, let me read it again. During this procedure, a radiologist makes a tunnel through the liver with a needle and connecting the portal vein, the vein that carries blood from the digestive organs to the liver, to one of these veins, which is called the hepatic veins, and there are 3 of them that carries blood from the liver. A metal stent is placed in this tunnel to keep the tunnel open. Remember, stent is always put there, like a person had a heart attack, they put a stent to keep the
The valve.
whether it's the artery, to just keep the blood flowing to that part.
Yes.
But sometimes they can't use a stent because it's so badly damaged. So now they have to do what? A cabbage, which is a bypass. Coronary artery bypass grafting. That's when you have too much damage or plaques in the vessel. So they have to remove the vessels and replace it with vessels. But if it's not that bad, they put a stent.
Isn't the stents put in a way so you can bypass the block while the
Mixed, the stent has the block. If the block, the thing is, if you want this here is well functioning, and the flow, right, of whatever has been detoxified, got to go into these hepatic veins. So he's taking, and it's not a big stent, right? Here he said a needle, and he's going to put it in the liver. Decided to put it into the liver, because it's not an entire liver
Having
having the problem. May have problems here, may have problems there, but have other parts of their livers functioning.
Accessible.
Because when those persons have cirrhosis of the liver, you find that the belly getting big, to the ascites, and they're still walking around and drinking a lot and doing a lot of crazy stuff, right? They don't die right away. Because parts of the liver still what? Functioning. But they're not having the type of function you need. That's why you want to do things like the LFT. To see how the liver is functioning. I'm basically saying the tips reroutes the blood flow in the liver and reduce pressure in all abnormal veins, not only the stomach and esophagus, but also the bowel and liver. And here it is. The TIPS procedure, this is very strange. The TIPS procedure is not a surgical procedure. The radiologist performs the procedure within the vessels under X-ray guidance. The procedure lasts 1 to 3 hours. You should expect to stay in the hospital for 1 to 2 days after the procedure. And they say the TIPS procedure controls bleeding immediately in over 90% of patients. However, in about 30% of patients, the shunts may narrow, causing varices to bleed again at a later date. So the shunts themselves can become what? Can close in and get blocked. And they say that is one of the complications of the procedure, is they can have narrowing of those shunts or blockage. And the encephalopathy or mental changes caused by abnormal function of the brain that occur within the severe liver disease is another potential complication. Encephalopathy can be worse when blood flow to the liver is reduced by TIPS, which may result in toxic substances reaching the brain without being metabolized first by the liver.
Toxic.
Go on and on.
Damage. Serious liver disease.
Now what are treatments you could have for portal hypertension? You could have a liver transplant. And this is done in cases of end-stage liver disease. Just like I have end-stage ESRD. What was that? What ESRD?
ASRD
ESRD.
or ESRD.
End-stage renal disease. And that's where you go and you have your dialysis. Now you have end-stage liver disease. And you need to have, see with the kidneys, they can put you in a machine and the machine is detoxifying the blood, right? But the liver is not detoxifying the blood, the liver is taking whatever you just finished eating and make it usable by the body. So there's a whole big difference there, right guys? You think you understand this?
I gotta go through it again.
Take a minute and look at it.
I'll do some independent study on that one.
There's something else you call devascularization. Devascularization is a surgical procedure that removes the bleeding varices, that is removing the varicose veins. Now, remember we said that the belly could get big, right?
Yes.
Yeah.
And we call it what?
Arthritis.
And they have to remove that fluid. And when they remove the fluid, you do a tapping, and that tapping of it is called paracentesis.
Paracentesis.
Put it down, guys. Paracentesis. Paracentesis. And please look at the image. Please look at an image for the paracentesis.
You want me to spell it? Like that. Removal fluids.
Is a procedure that removes fluid very from the abdomen through this slender needle. Jesus.
Paracentesis with albumin infusion.
How come you always have symptoms before? Tell me.
Research.
Oh, please.
What's wrong with the two of you?
I don't know. Tufyakwa.
You said I'm gonna want to feel good. Okay.
You can easily train yourself to listen faster. If you're able to listen fast, you can consume more information. Portal hypertension refers to high blood pressures in the hepatic portal vein, the large vein that carries blood from the digestive tract, spleen, and pancreas to the liver. Within the liver, blood runs through tiny channels where it exchanges contents with the liver cells. This is where nutrients are processed. Toxins and pathogens are removed from the blood before it exits the liver via the hepatic veins to enter the general circulation. Portal hypertension usually results from an obstruction or an increased resistance to blood flow, which may occur before, within, or after the liver. Most commonly, it happens within the liver due to liver damage in diseases such as cirrhosis and schistosomiasis. Cirrhosis is by far the most common cause in developed countries, while schistosomiasis, an infection by parasitic flatworms, is more prevalent in children from developing countries. Cirrhosis is the widespread scarring of liver tissues caused by long-term alcohol abuse, chronic viral hepatitis, or fatty liver. Clinical presentation of portal hypertension may include abdominal distension, known as ascites, a result of fluid leaking into the abdominal cavity under high blood pressures. Enlarged spleen due to congestion of the splenic veins. Formation of so-called collateral vessels as alternative routes for blood to bypass the liver. These new blood vessels connect some digestive organs directly to the general circulation. By doing so, they reduce blood flow through the portal vein and relieve portal pressures, but they may also cause serious complications. As blood pressures increase, these small vessels can become engorged and form varices, which may rupture and bleed. Variceal bleeding can be massive and life-threatening. Because collateral vessels direct blood away from the liver, toxins that are normally removed by the liver can now reach the general circulation and pass into the brain, causing symptoms such as confusion, drowsiness, tremor, or even coma, in a condition known as hepatic encephalopathy. Treatments aim to prevent and manage digestive tract bleeding and include ongoing monitoring with endoscopy and a variety of drugs. If these fail, surgery to reroute blood flow may be performed. Liver transplantation may be needed in case of severe liver damage.
All right, let me just go back.
And a variety of drugs. If these fail, surgery to reroute blood flow may be performed.
All right, you see the stent? Remember this is what? Portal, right?
Portal vein.
And then
This,
The stent.
this is the three,
This goes into the three hepatics,
hepatic.
right? But I just want to see how the stent go because you were asking, right? Now, where you have the problem, when you have a blockage, if it's here, these here are collateral
Collateral thing.
that comes into bypass blockage. Your body does that. Okay? And because they're bypassing here now,
The blockage.
you find the increased pressure going to cause these varices that sometimes rupture and bleed, which is the biggest problem. But also what can happen is because it's not being detoxified by the liver,
Liver.
you have it going up to the
Heart.
Brain.
Brain.
and that's where you get your encephalopathy. Okay? I think this is a pretty, animated diagram, which
Stop
is
abusing
easy to
it.
follow, right? Remember, these are just collateral, right? This is not the real
Where's your
stuff.
phone?
They just come in because of the blockage, and they try to go wrong. But it creates a problem because, like you say, you can get these varices, and you can also have problems whereby the microorganisms that is normally the pathogens that is normally removed by the liver now goes straight into the bloodstream. And if you notice, when it goes into the bloodstream, it's going up back to the heart.
The heart.
And the heart now is going to send it all around the body with
Systemic
systemic
circulation.
circulation. It don't leave the liver and go directly to body parts. Because remember what we talk about all the time? Vein.
Yep.
Vein.
Taking it back to
And
the heart.
vein now go back to where?
The heart.
And then when it gets what?
When it
All
gets
that
to the
stuff
heart.
it took up, some is going to get taken out by when you breathe, right?
Yeah.
And then it's gone into the what? The systemic circulation,
Circulation, yeah.
which is going taken by your what? Your arteries. But then arteries will go on to your renal artery, which is going to your
The kidneys.
kidneys. And what the kidneys will do now?
The filter.
Filter it. So it's a continue the whole process. So it's not going to filter it and produce a urine we were talking about just now, which is what? 95 to 96% is what? Water. And the rest is uric acid, right?
96, yes.
Does it make sense, guys?
Much more clearer now.
Any questions about dust portal hypertension?
Yeah.
You did hypertension when you did high blood pressure, right? But this is a different type of hypertension. This hypertension is related to the liver. And apart from the liver having a problem, it says another organ can become affected and so on. What organ we're talking about? Spleen. Why the spleen?
Because is this can do with a good job.
Cancer fight infections.
What's the function again?
Spleen. The graveyard of the erythrocytes. There's a lot of good stuff for you. The food doesn't just go into the body when you eat it. The food has to go through different processes. After the digestive system take out the what? The proteins, which it turns it into something called amino acids, right? Because that's the way it's going to absorb. It takes now the carbohydrates and turns it into sugar. I need a drink. It turns it into glucose. Remember glucose. And then the glucose now, it is not stored by the body. Glucose is now stored in the form of glycogen. And if you need the glucose now, you have to turn it back into, if you need glucose, you have to turn the glycogen back into
Glucose.
And then you have the fats. Fatty acids, glycerol. And believe it or not, we're not going to talk about how you got them vitamins A, D, E, K, and all them stuff, which is fat balls, which is what stuff. All this, but whatever you eat and it turns into those things, it got to go to where? Up to the liver. If it don't go to the liver, all of this bad stuff that you might have eaten, it could have some microorganism that is that resistive, like sporeformin. They're going to go straight into the bloodstream. And when it goes in the bloodstream, it goes, especially if it goes to your brain, and because the brain is what? The master, right? He makes all the decisions. Take a minute for that to settle it, and I'll pretty understand that.
You can get splenomegaly, right? Because of that.
You got splenomegaly, because the liver got now increasing a lot of stuff.
Overworked.
You see how you even start taking the high blood pressure medications? Propranolol, which is a beta blocker, is being used to reduce the pressure in those viruses to prevent them from what? Popping. You guys look tired. Take 2 minutes and get it together. And if you have any questions, ask now before we move on.
I'm recording all of that. Record all of that. You what?
You don't see nobody else there.
You have a what?
You never know. It's true. To come to America. See this every year when you come there.
That's good.
That's good.
That's good.
You're glad.
That's good. You're being helpful.
It's supposed to be.
Bless you.
Thank you.
You're welcome.
What happened to the candy?
You want more?
Oh, yeah, one.
Let me get more candy. My co-workers are sleeping.
Venous blood is returned to the heart by one of two systems, the portal system or the systemic system.
Give us a
The portal venous system drains blood from this vein and all gastrointestinal between the distal esophagus and the rectum. This portal blood is directed by the portal vein to the liver, where it is filtered before being returned to the heart by the inferior vena cava. In contrast, blood from the rest of the body is transmitted by systemic veins. These veins direct the blood back to the heart via the superior and inferior vena.
All right. What they're showing you there is your portal, circulatory, systemic. When we just talked about it, right? Portal, throws it back, goes to the heart, and then it goes about the body. Listen, guys, and put it together. Let's do just one more time. Listen carefully.
The volume is too low, by the way.
Through the systemic
Okay.
system.
That's
The
good.
portal venous system drains blood from the spleen and all gastrointestinal organs between the distal esophagus and the rectum. This portal blood is directed by the portal vein to the liver, where it is filled with before being returned to the heart by the inferior vena cava. In contrast,
being returned to the heart.
the body is transmitted by systemic veins. These veins direct blood back to the heart via the superior and inferior vena cavas. Because of this, systemic venous circulation is often referred to as the caval system. We will use the two terms, systemic and caval, interchangeably, since it is likely that you will encounter both in the clinical setting. Because the circulatory system is continuously closed, there are areas where systemic circulation and portal circulation are physically connected. For in healthy people, there is little blood exchange between these two, since the pressures in each are about equal. A portosystemic anastomosis refers to abnormal venous return in which blood flows the wrong way through these connections. In most instances of portosystemic anastomosis, blood from the portal system that should flow towards the liver instead avoids the liver by flowing backwards to join the systemic circulation. Why does this blood avoid the liver? Because of a condition called portal hypertension. Portal hypertension means that the pressure in the portal vein is abnormally high, much higher than the pressure in the caval system. This usually results from liver disease that makes blood flow through the organ more difficult. Portosystemic anastomoses are important indicators of liver pathology and can lead to swollen veins called varices that may cause clinical problems. In this video, we will discuss three common types of portosystemic anastomoses: esophageal varices, caput medusa, and anorectal varices. Let's begin with esophageal varices. Blood from most of the esophagus does not pass.
Alright guys, look at those three please. Alright, look at those three. And varices is those varicose veins, right? Look at those, and it's all related to what? Portal hypertension. This, the one that's going to be in your buttock is not from just training where you're going to have a bowel movement. It's having portal hypertension now. When you have problems with the flow of blood to the liver. Alright, there we go. Look at this carefully, guys.
With the liver, it is transmitted to the heart by the caval system. However, the distal portion of the esophagus does send its venous blood inferiorly to join the portal system. In the region where this transition occurs, there are venous channels that connect the portal and caval systems. Under normal circumstances, there is very little backflow through these interconnecting channels. However, when portal blood flow through the liver is impaired and portal pressure becomes high enough, then some portal blood will be shunted to the lower pressure caval system through the interconnecting channels, thus forming a portosystemic anastomosis. Portal blood will continue to be sent directly to the caval system until the pressure in the two systems becomes equal here. If a large amount of portal blood is shunted this way, it can cause the smaller systemic veins to dilate and form varicosities, or varices. Varices are weakened segments of vein due to the fact that their walls are stretched and thin. Varices can form both on the external surface of the esophagus and internally under the esophageal mucosa, where they protrude into the lumen of the esophagus. Internal esophageal varices are very dangerous, since these swollen vessels may eventually rupture and release a substantial amount of blood. This bleeding is often not immediately apparent, since the leaking blood is swallowed and passed through the GI system. In many cases, the first sign of bleeding esophageal varices is black and tarry stool caused by the breakdown of red blood cells in the GI tract. This is a potentially lethal condition, often associated with massive acute hemorrhage, and represents a medical emergency. Esophageal varices are the
Guys, you heard that?
of pathology.
You heard what you just said just now? Listen very carefully.
Of red blood cells in the GI tract. This is a potentially lethal condition, often associated with massive acute hemorrhage, and represents a medical emergency. Esophageal varices are the most dangerous result of pathological portosystemic anastomoses, but anastomoses also occur in other areas. Regardless of the region, though, the underlying process is the same. Increased pressure in the portal system shunts portal blood to systemic veins, and the subsequent increase in volume passing through the systemic veins causes the formation of varices. Now let's look at two other portosystemic anastomoses, caput medusa and anorectal varices. Caput medusa, or in English, Medusa's head, refers to swollen subcutaneous veins on the surface of the abdomen that radiate out from the umbilicus. The appearance of these swollen, tortuous veins reminded early clinicians of images of the mythological.
You know, when you see the veins on the abdomen of your patient, normally you're not going to see the veins in the abdomen, right? Those tortuous varices. If you see those varices on the abdomen, is indicative that this patient is having portal
Hypertension.
And resemble the head, that snake-headed woman.
Greek goddess Medusa, who is depicted as having
There you go.
strokes in place of hair. Caput Medusa results from portal venous hypertension in the umbilical vein that spreads into subcutaneous systemic on the back. The umbilical vein is important during fetal development as it delivers oxygenated blood from the placenta to the fetus. Along its course, the umbilical vein also receives blood from small systemic veins on the surface of the abdomen. The umbilical vein delivers some of its blood directly to the liver. After birth and removal of the placenta, the umbilical vein no longer transmits blood. It gradually becomes closed off, but remains in the body as the ligamentum teres hepatis, or round ligament of the liver. Even though the round ligament does not normally transmit blood, it still maintains the remnant of a lumen, and the pressure increase from portal hypertension can be sufficient to reopen this channel and allow backflow of portal blood to the superficial veins of the periumbilical region. These then become engorged, forming the caput medusa. While caput medusa can be indicative of severely elevated portal pressure, it is not itself dangerous, since the risk of significant bleeding from these swollen vessels is low. Finally, portal hypertension can lead to anorectal varices, or hemorrhoids. Venous blood is transmitted from the rectum by three interconnected veins: the superior, middle, and inferior rectal veins. The superior rectal vein is the only one of the three that contributes to the portal circulation. Thus, because these three veins are interconnected, portal hypertension can cause backflow of blood down the superior rectal vein, which is then transmitted to the middle and inferior rectal veins. Again, the increased volume and pressure of this backflow leads to varices in the systemic middle and inferior rectal veins. Anorectal varices resulting from portal hypertension are not usually painful, since they most often occur in areas with visceral innervation. However, these varices can be the source of chronic bleeding, though the volume of blood loss is not as dramatic as that associated with esophageal varices, and it is unlikely to represent a medical emergency. Treatment to relieve portal hypertension often involves surgical manipulation to divert large amounts of portal blood directly to large systemic veins that can handle the extra load. One approach is to surgically join the portal vein and inferior vena cava, which lie in close proximity to each other within the abdomen. This artificial portal cable anastomosis allows portal blood to flow directly into the inferior vena cava, thereby lowering the pressure within the portal system. Likewise, a portosystemic anastomosis can be achieved by joining the splenic vein with the left renal vein. Finally, a more modern approach is called transjugular intrahepatic portosystemic shunt,
TIPS.
or TIPS. TIPS involves inserting a catheter into the jugular vein and threading it through the superior and inferior vena cavas to reach a hepatic vein tributary within the liver. From here, a channel is made through the parenchyma of the liver to reach a branch of the portal vein within the liver. The stent is then inserted to maintain a communication channel between the portal venous system and the systemic hepatic vein.
Was it a little more clearer? A little more clear? Any questions related to portal hypertension? Now, what is, you heard the word keep being repeated? Anastomosis. What is that? Rejoining. Anastomosis osmosis, guys. The anastomose bring together.
Reconnection of two streams that previously branched out. Did you hear that, sir?
Connection of two what? Veins?
First it says it's a connection or opening between two things that are normally divergent or branching, such as between blood vessels, leaf veins, etc. It's a connection or opening between two things that are normally Oh, it's a better one. It says, a surgical anastomosis is a surgical technique used to make a new connection between two body structures that carry fluids, such as blood vessels or bowels.
Here's the joining two vessels. Okay? Alright. What did we remember just now when we were doing it, you were talking about with the portal hypertension you can get encephalopathy, right? They have problems with patients becoming confused, and we went through the rationale about because the liver is not detoxifying the blood, you find microorganisms or what have you can go up to the brain, right? Different stuff can happen. So let's look at what is a hepatic encephalopathy.
Today I'll be discussing hepatic encephalopathy. By the end of the video, you'll be able to describe the pathophysiology of hepatic encephalopathy, including its relationship to ammonia, to list its risk factors and clinical manifestations, and to prescribe appropriate treatment for a patient with encephalopathy. Hepatic encephalopathy is a syndrome of altered neurologic function related to a dysregulation of metabolism seen almost exclusively in patients with severe liver disease. It's often a chronic problem in patients with cirrhosis, managed medically to varying degrees of success, punctuated with occasional exacerbations. Although these acute exacerbations are rarely fatal, they are a frequent cause of hospitalizations among patients with cirrhosis. There are many theories about the pathogenesis of hepatic encephalopathy, but ammonia plays a central role in all of them. Ammonia, much of which is absorbed from the gut, is normally converted to urea by the liver as part of the urea cycle. But in patients with cirrhosis and subsequent portal hypertension, portosystemic shunting develops in which lateral blood vessels divert venous blood from the intestines, bypassing the liver to directly enter the systemic circulation. The consequence of this is higher than normal concentrations of ammonia in the brain. This shifts the equilibrium in two critical enzyme-mediated reactions. First, it shifts the balance between the citric acid cycle intermediate alpha-ketoglutarate and the neurotransmitter glutamate towards the latter. Among other things, this results in a decrease in cellular oxidation and ATP production. The second reaction is one in which glutamate and ammonia are converted to the amino acid glutamine, specifically within astrocytes. For complex reasons, this results in cerebral edema and oxidative stress. Having gone through that, it's important to realize that ammonia is not the whole story. Consider this study in which 121 consecutive patients with cirrhosis who were admitted to a hospital for any reason had their ammonia levels measured and had the severity of encephalopathy determined by clinical exam. Here's what was found. Each dot represents one patient. I'll discuss the grades in a minute, but as you might guess, the higher the grade, the worse the encephalopathy is. Grade 0 means that there is no detectable encephalopathy at all. As you can see, there is certainly a relationship between ammonia levels and severity of encephalopathy, but it's not perfect. For example, almost half of patients with no encephalopathy had elevated ammonia levels, and there were other patients with very severe encephalopathy with normal levels, including one who was literally comatose. So if the correlation between ammonia levels and encephalopathy is not perfect, what else might be going on? Well, some additional contributions to the pathogenesis of hepatic encephalopathy likely include altered levels of other neurotransmitters, increased permeability of the blood-brain barrier, increased inflammatory cytokines, and alterations in the gut microbiome. There are many risk factors for developing encephalopathy. The biggest of these is a side effect of a procedure called TIPS, which stands for transjugular intrahepatic portosystemic shunt, in which an artificial channel is percutaneously created between the portal vein and the hepatic vein. By decompressing the portal venous system, this procedure reduces the probability of bleeding from esophageal varices and makes ascites easier to treat. However, the risk of encephalopathy is much worse. Another risk factor that's localized to the liver is portal vein thrombosis for similar reasons. Other risk factors include acute infections, particularly spontaneous bacterial peritonitis, acute kidney injury, and electrolyte derangements, particularly hypokalemia.
All right. You see the abdomen? There's an infection. What did he say? What infection was that? Listen carefully, please.
Varices and makes ascites easier to treat. However, the risk of encephalopathy is much worse. Another risk factor that's localized to the liver is portal vein thrombosis for similar reasons. Other risk factors include acute infections, particularly spontaneous bacterial peritonitis, acute kidney injury, and electrolyte derangements,
What did you say?
particularly
Spontaneous bacterial encephalitis.
What?
Bacteries.
Spontaneous spontaneous bacterial
Listen again.
peritonitis.
system. This procedure reduces the probability of bleeding from esophageal varices and makes ascites easier to treat. However, the risk of encephalopathy is much worse. Another risk factor that's localized to the liver is portal vein thrombosis for similar reasons. Other risk factors include acute infections, particularly spontaneous bacterial peritonitis,
Bacterial what?
Peritonitis.
Peritonitis.
Bacterial peritonitis. And what's bacterial peritonitis? The
Infection
lining that covers your intestines.
Yes.
Remember I tell you guys
Peritoneum.
anything with infections in there, you need to peritonitis, which is one of the complications, big complication.
acute kidney injury, and electrolyte derangements, particularly hypokalemia. GI bleeds, in which encephalopathy could be triggered by what amounts to the ingestion of a large protein load, as well as from intravascular volume depletion, and both
In a large protein load, what's a large protein load? A lot of meat,
Okay.
okay? All right, let me just come out of this here. And now I want to look at this.
So I've got my essay written, and I've been working on it for about a week. So now I'm going to show you how I use Grammarly to edit. Okay, so here's my essay. Our topics today are hepatic encephalopathy and lactulose. Lactulose is a non-absorbable sugar related in structure to the disaccharide lactose. Lactulose is not digested by the stomach or small intestine, but instead passes all the way to the large intestine. In the large intestine, lactulose is broken down by colonic bacteria into acetic acid, formic acid, and lactic acid. This action creates a hyperosmotic environment inside the lumen of the large intestine, which acts to draw water into the lumen. This added water softens the stool and also distends the intestine, which leads to an increase in peristalsis or gut motility and gets things moving. This action thus increases the likelihood of defecation. Therefore, lactulose is useful in the treatment of constipation. Another important indication for lactulose is usage in a condition known as hepatic encephalopathy. Hepatic mean liver and encephalopathy referring to brain damage or malfunction. A healthy liver is an important organ for the breakdown of amino acids. Amino acids have a nitrogen-carbon-carbon backbone. The nitrogen group or amino group can be removed from the amino acid in a process known as deamination, which primarily occurs in the liver. Deamination also yields a leftover 2-carbon molecule that can either be recycled or broken down further by entering the Krebs cycle and oxidized to make ATP. The removed amino group becomes ammonia, or NH3, and is toxic to the body. So enzymes in the liver add a carbon dioxide molecule onto the ammonia to form the much less toxic urea in a process known as the urea cycle. Urea can then be excreted out of the body by the kidneys. When the liver becomes damaged, it no longer converts ammonia into urea. So ammonia levels in the body and brain begin to rise. The brain is particularly sensitive to the effects of ammonia. Elevated ammonia levels can lead to brain damage, a condition known as encephalopathy. Lactulose administration helps to bring down ammonia levels in the body. When lactulose is converted by gut flora into acetic, lactic, and formic acids, an acidic environment is created. It causes a change in the relative amounts of ammonia and ammonium ion, described by this equation. The acidic environment, or additional hydrogen ions, causes ammonia, which is NH3, to be more readily converted into ammonium ion, or NH4. NH4 is charged and is therefore unable to cross membranes for absorption into the blood. So instead, it is excreted in the feces. This excretion leads to a reduction in serum ammonia levels for those with hepatic encephalopathy.
All right, you guys got that? Why patients who are, the only way to give patients who have problems with portal hypertension, those are the persons who will receive the lactulose, because these patients are having encephalopathy, and encephalopathy can be due, and this is on the first video we're looking at, to the amount of ammonia that's in the blood. Now, lactulose, through all those changes that you just looked at there, don't worry about those numbers and things, don't get yourself confused. Just know that lactulose will cause the ammonia
level down.
Not to be absorbed, but to be gotten rid of when you go to the bathroom. If you use regular medications, what do you use to get the bowel moving? So what's the term and what's the use to get rid of feces?
Laxative.
Right? So if you use regular laxatives, the ammonia will still be what? Absorbed. And get lactulose. That is why when a person have the encephalopathy, they use lactulose. So the ammonia can be get rid of.
Good enough.
Now those are two that we looked at today. I'm not going to go forward because I see people nodding.
Hepatic encephalopathy and
hepatic encephalopathy
and hepatic hypertension.
I thought you were saying you can't have hepatic encephalopathy. You're not remembering things. Okay. Take a minute. Think about what you just saw. It may sound a little confusing right now, right? Oh, it's a very. Understand that the liver plays a great part.
And your back.
You're going to eat it, right? The food,
Yes.
right? We broke down the food into the different types. But this food now, after it's been broken down, don't just go to the body and give you nutrients. You have to go to where? The liver first. And the liver now will process it. And then send it on where? After it's processing the liver, where it sends it on to?
To the brain.
It sends it on into the blood to go where? Not to the heart. So now the heart can send it all around the body. Alright? And when it will send all around the body, it's going to now send on to specific place also. That will help to do more cleaning. Which is this? Kidneys. Right?
Yes.
Because during the process, uric acid developed.
You mentioned it.
But it's mentioned when the kidney not working well, and the ammonia level go up.
You also mentioned
The kidney can only produce, remember, before it goes directly to the kidney, you have blood that is going to other places in the body. Alright? Including the brain. So what you try to do is you want to get rid of their ammonia before it gets into the bloodstream. That's why you're going to use the lactate. You're going to just pass on instead of being absorbed and go straight to the liver. You don't need that. Right?
you briefly touched on the spleen. I wanted to talk about that just a little bit more.
What the spleen does?
The graveyard of
Just look at the different functions of the spleen. Apart from destroying worn out red blood cells,
The old
what
one.
functions of the
Fight
spleen?
your
It's
big germs and the blood.
the old cells.
Guys, remember
Old things not working.
your
Old cells or whatever.
everything in your
This is
body
what this thing does.
is set up to fight
I'm white.
I don't know.
diseases.
Check it and see.
You said?
We talk about
The old
your lymphatic system that
Okay.
returns the fluids
You're right.
back to
I
the
think
blood,
you're right.
right? But the lymphatic system, before it turns our fluid back to the blood, what the lymphatic system does?
Filter.
It filters the blood,
yes.
because where you have the what? The lymph nodes, the
Yes.
600 lymph nodes. You know those things that get swollen on your arms when you get a cut? Or on your groin? Because what they do, they capture those microorganisms that invade the body and got into the blood, they capture it. And they do what? They kind of strain it, pull out those microorganisms, or you said filter it and set it on. Your liver now takes the food and do the same thing. Your kidneys continue the process to get rid of it. So your body is always trying to cleanse itself. And not you going to the bathroom and using what?
Mouthwash.
Other thing number 2, cleansing out 3 day, 4 day, what have you. You want to clean it out? Clean it out. But the body has a system, and what you should be using is to help the body. Alright? Help the body.
That's right.
You do not want to use, and we said this before, you never want to use laxatives. do not want to use laxatives. We said that, right? Laxatives is not good for you. You have to develop what? A good bowel
movements,
and if you have the
schedule.
problems, you should work on what?
Oh, fruits and veggies.
Your diet.
What is your diet?
Okay.
Right? Exercise.
Exercise, yes, because
Right.
Plenty of water.
Natural thing. And then before you get to the laxative,
Exercise,
you want to do something
Fat.
like we call stool
cereal.
softener. A stool softener is not the one that's a laxative run, but it's going to assist you to go. Before you start to finally run and jump on there, laxative. Because when you do this, you're training your body now that if you want to have more movement, you got to have a laxative. And diseases, and each medication you use have a specific purpose. And even the things that you use can be a problem. Like they say, one of the biggest problems why people get the encephalopathy, hepatic, is when they do what? They do that same surgery, the tips. The tips is done so that you're going to have reduced varices and you're having those problems with bleeding. But then it will lead to increase of the hormone goes up to the
common
brain.
factors, the
So that itself has a
encephalopathy.
Okay?
Encephalopathy. What? I have to know the word.
We're not going to go on to the other two.
I have to move away from that. That's in my ear all
Only
day.
those two because right now, by the way, read up on your GI system. Okay, do all your GI systems, all the people. Guys, make those connections between your different systems, how diseases in one system, how it affects another system. Like now you're talking about the liver having a problem, and it affects what? Your brain, right?
The heart,
Yes,
the systemic circulation.
yes,
So
because
just look at all these
if it's in
connections.
the toxic
Don't just say
blood,
the heart,
if it's in the
oh, the heart.
toxic blood, it's gonna affect the whole body.
That's right. The toxic blood.
Yes.
right.
Because it's the
And
toxic.
most of all, guys, like just now they talk about a worm that can cause
Yes.
problem, right?
Yes, for children.
What?
But this worm is only in the
Countries.
tropical
What?
places.
A worm.
A larva.
A worm.
Guys,
Yes,
In order for
please, every time you look in YouTube where you're putting up stuff, always list common.
Complication.
Common, meaning things that is happening where? Here in America, not
Today.
things that's happening in Africa or India. Because you're not going to be tested in that. You'll be tested in things that is happening in this country. All right? So those things that you see, no, don't go with that. Yes, they're talking about putting worms or larvas in people's wounds and that sort of stuff. But I can
don't
safely
happen
say
here.
that ain't gonna come, no way. President, you can understand and know that we use maggots to wound debridement. Okay? I also say you gotta look at what? Proteins, right?
yes.
So this make you want to feel like you should become a vegetarian. If proteins can create a lot of problems
Meat
in
is,
the body.
the meat is too tasty.
Last week Sunday was what? Last Sunday or the whole of last week? I know it culminated on Sunday. It was supposed to be a vegetarian week. Where people focus on being vegetarian because you're who? You're male?
yeah?
You went back 6 months. I'm trying to push it in the schools too.
I tried for 6 hours.
Not my children.
6 hours, I couldn't do it.
I try until I see it in front of me. So
have
I'm
something
not
they
gonna
call
say I
VO.
tried.
But I do,
Oxtail.
like I did cut back on my meats.
Stop it.
Like I cut it from, instead of 4 meats, I just eat 1. You know?
Okay.
Instead of filling my plate with 4 meat, I just put 1 meat.
Okay.
I'm still doing that. Yeah.
You vegetarian too?
No, God forbid. But I cut back.
I cut some, but I cannot
I cut
stop
back.
eating my oxtail.
I'm gonna buy some right now. Rice and cheese is broken.
Mr. West, I remember yesterday you mentioned we should review the reproductive system. So also do that and digestive?
No, we still do the review,
Okay.
but I want to review digestive system,
Also, okay.
the bloods and blood disorders,
Okay.
all that we did.
Okay. What do you call the blood? What do you call the blood system?
All right, let me just look at this last video. It's about just
The system with the blood.
12 minutes.
Platelets.
No, just for like blood.
Varices are originates in the liver. What happens when cirrhosis progresses is that as it progresses, the liver develops scar tissue.
Oh, look at this.
As that scar tissue originates in the
What's supposed to be for, you notice at the top here? Nursing overview.
Oh, this is nice.
All right?
liver. What happens when cirrhosis progresses is that as it progresses, the liver develops scar tissue. As that scar tissue continues to progress across the liver, it begins to limit blood flow. Okay, we know we have a couple of really major veins within the liver. We have our portal hepatic vein, and what happens is that as the blood flow becomes obstructed through there, the liver starts looking for other places to send all that blood flow. Okay, so as that blood flow starts to shunt to other locations, it begins to move to places like the esophagus and right around the stomach. So right next to the liver, we have all these veins along the stomach and within the esophagus as well. Okay, so the blood begins to shunt, and it shunts to the esophagus and it shunts to kind of the stomach as well. So the lower part of the esophagus and the stomach, these little veins along there become very dilated, okay? These are not huge veins, these aren't big veins, they're much smaller veins, but what happens is as that, all that pressure from that liver blood flow begins to force into those areas, to the esophagus, as those veins become very, very dilated, okay? So here's our esophagus, and so those veins along there become very dilated as that liver blood begins to push into there. So that dilation of those veins along the esophagus is known as esophageal varices. Now the risk with these is like I said, these are very weak veins, so they can rupture. Okay, as that pressure builds within them, it builds and builds and builds, and it continues to dilate, and finally eventually it'll just rupture. Now that's a huge concern, because like I said, there's so much blood flowing through there. So as that liver blood continues to come into the liver and then shunts away into the esophagus, if those rupture, you have a tremendous amount of blood that begins to spill out. Okay, so your patient can lose a ton of blood. One of the ways they can lose blood is from these esophageal varices rupturing, and then they just start to spew out blood. Just huge and huge copious amounts of blood. Okay? So what we can do for these patients is we can insert what's called a Blakemore tube. Okay, and this tube goes in through the mouth, down the esophagus, and then into the the upper portion of the stomach, okay? And on this tube, there's a balloon at the end of it. There's a balloon that you can inflate, and the balloon will press against the wall of the esophagus and the upper portion of the stomach, and it will push pressure against these varices, okay? So as it pushes that pressure against those walls, it prevents these veins from rupturing. Okay, so you insert the tube almost just like you're doing an NG tube or an OG tube or something like that. So you just kind of insert it like you're doing an OG tube, and then there's little ports where you can fill with air, and it fills that with air, compressing against the walls of the esophagus and the stomach. And that's going to prevent the rupture of those veins. Because that's really kind of what we do for these patients. And the whole goal of this is to prevent that rupture and prevent that tremendous amount of blood loss. Okay, so that's really a basic overview of esophageal varices and what we kind of do with the blowhorn tube it's called like a balloon tamponade here that we do to prevent the rupturing of those esophageal varices. All right?
Okay. Also, sometimes when persons get things like epistaxis, bleeding through there, they also use those balloons. You need to insert, and the pressure of the balloon against the wall will stop the bleeding. Okay? The nose, yeah.
Circulatory system.
Back, and it presses again,
Yeah, that's what I meant.
and stop the bleeding. That's the back, the nose there. Alright? Just like how they want to stop the breakmore in the esophagus, esophageal varices, on the upper portion of the stomach. They put the balloon, the tube in. It's just like your Foley's catheter. If you look at your Foley's catheter, you know you have what? Inflatable. But this is a little different than the Foley's. And insert, wear through the mouth, right? I'll put it through. And then when it creeps around there, just before you go to your cardiac spacer, right? You inflate. And presses against, when it presses against, it creates that pressure. So that will decrease bleeding. Loss of blood is loss of life. You bleed, you find persons will bleed to death. Like a young man who used to come over by the place there and have those guys up, somebody stabbed him in his chest. And before persons tried to help him, people were doing what? What do you call that thing? When the vegetate. Something warm. What's that? This call it out and then they sell it in and they get money or something like that. Something warm. Warm star, right? Warm star, something like that, right? And when you vegetate whatever it is and you send it in, you get it. But you gotta mention warm star or something. That's what people do it, and the poor kid was there and he died. It took 20 minutes before somebody get him an ambulance. And boy, if you call the EMS, they come very fast, right? He could have been alive. But people that prefer to
Make money.
vegetate. Oh, nice guy. It's a young Haitian guy too. Very young guy. Very, very nice guy. Very nice. Alright guys, put yourself together and I'll see you.